We're going to get started with our SCAI-TV career webinar series, where we are going to be talking about how you make your presentation your best. And today we have Dr. Melissa Wood. Dr. Wood needs absolutely no introduction. She is the chief physician executive at Lee Health Heart Institute. Dr. Wood has also been on the board of the American College of Cardiology. She was the chair from 2022 to 2023 for the ACC Board of Governors and secretary of the ACC Board of Trustees. Welcome, Dr. Wood. We are so grateful for you being here today.
Thank you, Dr. Serene, and the other panelists for inviting me.
Thank you. We also have amongst us Dr. Leah Raj from Vanderbilt. She's a complex PCI operator at Vanderbilt and is going to be talking to us about tips to meaningful presentation. Dr. Raj, thank you for being here today.
Thanks, Nisha. Appreciate it.
And then we have Dr. Jenny Jabla. Dr. Jabla is also an interventional cardiologist who is from Children's Hospital, Colorado, and Associate Professor of Pediatrics at University of Colorado. Dr. Jabla is going to be talking to us about the art of medical storytelling. We look forward to your presentation. Thank you for being here today, Dr. Jabla.
Thanks for the invitation.
Thank you. Please may I request Dr. Raj to get started with a presentation on tips to meaningful presentation, the art from Dr. Raj. Thank you.
Great, thanks, Nisha. So I'm going to be talking about tips for delivering a meaningful presentation. During this short talk, I hope to discuss a few things. First is the importance of utilizing learning objectives to create an outline for your talk, steps to structure an educational, meaningful talk, and then how best to facilitate audience engagement. The first step is to know your environment and your audience. Before creating your outline and your learning objectives, it's important to, one, know your presentation topic, but two, know your presentation environment. Throughout your career, you'll be talking in multiple different environments, spanning from, scientific sessions at SCAI, where you'll be speaking on, some of the founders of things that we do, other national, international meetings, and then all the way down to community events that are directed at your patients and patient families. And so your audience can range from your colleagues, your health staff, your medical students, or nurses and techs. And so as such, your format and your language needs to be customized based on who is watching you and who your learners are and what their background is. The learning objectives help you create a framework for your talk, and it's a great opportunity for you to define what you want to teach and what you want your learners to take home. And then once you create a structure for your presentation that's based on your objectives, then you can stick to that outline with your slides and your talk. The structure will help you stay true to the right amount and right kind of information to help learners get to the end you want, that you have in mind. So as faculty, you have a specific length of time to make your points. And so focus on how to meet the objectives of your presentation in that allotted time. Avoid the trap of creating a presentation and then retrograde writing your learning objectives. So you want to state these learning objectives clearly at the beginning of your presentation. This can be on a dedicated learning objective slide, similar to what I did, or you can present a brief case and then offer 2 to 3 key questions, which are learning objectives for the talk. You can even display this outline to the audience on your slides, and it helps them follow along and reminds them of your objectives. And at the end, you can remind them what they learned. All right, so less is more. So some danger statements that you hear people saying. I know you can't read this, but ... or buckle your seatbelt because we have a lot to cover. So these are not ideal statements. I don't think anyone's ever excited when you hear your speaker say this. So it's not your responsibility to cover everything in this topic. The less you cover, the more your audience will remember and take away from the presentation. If you find that you have to reduce your font size to put the text on a slide, consider that a cue that you're putting too many words on the slide. And then simple things like avoid clashing colors, keep uniformity of fonts and grammar, can help learners focus on the content and avoid distractions. Visuals can be a powerful way to capture people's attention, deliver a message, and then make key points. They can again serve as cues to learners for knowledge and memory. And they'll almost always be remembered more than any text. But the key to using graphics and visuals is to select images that are simple, benign, and readable. Ask yourself if this image or graphic or table will emphasize your message or will it distract from your key points. Remember in like elementary school or middle school when you like learned how to make a PowerPoint presentation and you use all the animations you possibly could fit in there on one slide? That is not ideal these days. So you want to keep it as simple as you can. Finally, you want to connect your takeaway points to the learner's experiences so they're useful. So you can kind of frame them in behaviors that people can recognize and replicate. For example, the next time you see a patient with blah, 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 or dealing with this, like we discussed, remember to blah, blah, blah. And then finally, by reducing your slides and making the information on the slide easier to read, you're becoming a more concise presenter. So a little bit more about graphics. So if you want to display a table or figure, I think that's great, but don't do what I did here on the right. So instead of copying an entire table with so many variables, that's going to take the person minutes to read and decipher and find something that's actually interesting or important for them, make a new one with just the relevant data that you want the person to take home. And so when you use these kind of concise graphics and visuals to emphasize the points, try to avoid too many on the same slide. So be selective in which graphics you display. So interactive tools, similar to what we're doing today. So presenters can choose to use interactive tools like an audience response system, and it offers many advantages for presenters. It can improve the attentiveness of the audience, increase knowledge and retention, can track individual responses, allows participants to answer questions anonymously. You can display the results, and most importantly, can create an interactive environment. To effectively use it, you want to consider a few questions. So first is, how can I use it to involve participants in a meeting way, rather than just causing a distraction? Second is, what do I want the key points for my participants to take away? Again, this can go back to your learning objectives and your outline that you've given the talk. The next is, what questions could I use to identify audience knowledge and allow for more in-depth discussion? So again, this kind of has to be tailored to your environment. Not every talk you give allows for audience responses or discussion. And then last, what questions can I incorporate that will allow the participants to be involved more actively in the session? Again, I think this depends on the type of environment you have. But you always want to inform your audience of what type of engagement tool you're using prior to the start of the presentation and how to use it. You should incorporate a variety of questions like true-false questions or multiple choice questions that can help participant engagement so you're able to determine their knowledge on a given subject or topic. But be mindful of the time it takes to set up the system, pose the questions, wait for the responses, and review the responses. So make sure you leave enough of those for each question. So reviewing slides is incredibly important. Don't be afraid to edit with a heavy hand. And you don't think you want to discuss something, it shouldn't be on your slides. The most important thing, I think, is run spell check. You want to avoid distractions, and typos are a distraction. And the learner's going to walk away with remembering your typo and not necessarily the important point you had on your slide. Planning your delivery. So unfortunately, when I went through cardiology and interventional training, it was during COVID. And so conferences were few and far between. So in recent years, I've made it a priority to attend national and international meetings, partly for the education, partly for networking, but also a good part of it is just to kind of catch up with my friends and old co-fellows. And so I've had a lot of takeaways from watching other presenters at conferences. And the biggest takeaway that I have is that you should know your slides well enough so you can present them with your eyes closed. You should focus on telling the story of your presentation rather than reading the slides verbatim. The slides are there to supplement your discussion. Other things are making sure you're enunciating key facts, using vocal intonation, and speaking without verbal filters like and things like that. And so also I suffered a lot from imposter syndrome, and still do to some extent now. So when I was asked to present at SCAI or other conferences, I'm always I'm speaking to people who know more about the topic than me. And so I don't want to misspeak or forget something. So I always stick to my slides. But again, people aren't there to watch you read your slides. I found that people who are most comfortable at the podium are those who, one, yes, do know the subject of their talk, but two, deliver their talk with confidence and make it as natural as possible. Finally, your talk does not end with your last slide. You should expect some challenging questions. So you always want to thank the person who's asking your question. Sometimes it's best to repeat the question and give yourself some extra time to come up with the answer, or don't be afraid to ask them to repeat the question to make sure you understand. You never want to show that you're afraid or nervous or defensive, and just answer to the best of your ability, or pivot to something that you do know. So here's a few takeaway points for everybody. I hope this allowed you the importance of creating learning objectives and using them to develop the outline of your talk. Knowing your audience. Key point is less is more. Utilize graphics, interactive tools to keep your audience engaged. Always remember you should spend enough time reviewing your slides and practice your delivery, as well as preparing for questions from your audience. I'll stop there. Thanks, everybody.
Thank you, Dr. Raj. That was a great presentation. I just have a quick question for you before we go on to the next presentation. So when we talk about questions from the audience, do you typically recommend the questions be asked at that point of time, or perhaps a pre-survey and post-survey? How do you recommend these questions be posed to the audiences?
Yeah, do you mean like an interactive tool type of questions? Yeah, so I think there's multiple ways to do it. I think one would be pre and post. I think that'd be great. It also gives you an opportunity to show how much you've taught the audience and whether you've delivered in an appropriate way, that they've learned something from your talk. I think in the middle or in random spots of your talk is also great, just to kind of change up the speed of your talk and the interaction between you and the audience. But again, I think you have to find the right place to do it and the right questions to ask the audience.
That is actually very true. Thank you for answering that. Typically, if you do like a poll before and after the presentation, when you see the graphs changing, that sometimes tells you right away if the talk has made the impact and you have touched on the point. Some really great learning tips. Thank you, Dr. Raj. We're going to go on to the next talk by Dr. Zabla. Dr. Jenny Zabla is going to talk to us about the art of medical storytelling.
Thank you so much. Let me see if I can share. Dr. Raj, do you mind stopping? There we go. Thank you so much. So I think it's really important when we're talking about giving presentations, being able to keep you engaged. Mostly when it's a webinar, it's so hard. And hopefully everybody is watching and not on the phones. And this is part of our mission here, trying to keep you engaged. And this is like a lot of the goals that we have of how to give an effective presentation. And we can go from very expert talks to what we're doing right now, and understanding the basics of an effective presentation is going to give you success. We have to master the art of storytelling. What does that mean? Anything we do, either from technical stuff to very basic things as we're talking right now, we have to be able to tell a story so we can engage. If we're giving facts or just going off, talking and repeating things, just as Dr. Raj said, it's going to become very boring. And the education is going to be minimal because we're just there trying to survive through the presentation. So visual aids are key. You can see how we all are different as we present. You can see our different aspects and backgrounds that's going to help us actually communicate maybe the same message in different ways. And that's the beauty of having a diverse group, and even within our women group. Enhancing the verbal and nonverbal communication skills are also key, and it's very difficult as we are on a virtual world now more often than not. And engaging you all when I cannot see you is very hard, but when we're in person is very, very easy, as you can see people's faces if you feel not too nervous doing that. So let me go here next. If I'm going to talk to you about congenital heart disease, which I know that most of you are structural or like in any other way, adult cardiology, as we call it in pediatrics, you'll be very bored if you see this slide. So don't do that. That's not going to catch anybody's attention. You have nobody learning about congenital heart disease. What if you show graphics and explain what you're going through, like what the abnormality is? You can give some contrast on the slides and also just write very few words and context that you can give some explanation as you go through. So this to me is more effective than a lot of words. And again, you don't have to say it all in one presentation. There's more. You can divide your slides and you can give more information with more graphics, mostly if you know that your people that are listening to your presentation have different specialties. Sometimes you're going to go to a med school or even more complex presentations. Having more graphs and videos are going to help more. You can still have the same content in the same amount of slides, but just make it more dynamic. So how do you start? They give you a topic, and then you have to develop that. We all have different techniques, but we have to know the audience, and we have to consider their interests and how much do they need to know about the topic to start building that, and have a structure in your head of what things do you need to communicate and what other things would be nice to communicate. And then you can cut the content to make sure that you're not overdoing it, especially if you get 10 minutes, 7 minutes to present. You have to be concise. But the best part of all, tell story. And it's not, as I said before, it's just building the whole context in a way that flows. So for example, you can have a personal highlight. So you have pictures with your patients or a story or just distract people. So if you add a personal touch, can be humbling, allows having like the audience engaged. What's she talking about now? What is that about? If you have relevant narratives that allow just a refresher in the presentation, just, you have a long talk, very complex stats, and I'm going to say complex, but really we know it's boring. Sometimes they're relevant, and we all take pictures sometimes of that slide that we can refer to and we never see them again. It's very important to just highlight important topics. And then if you're not one to share stories, just add a light slide in between all this, just to catch people again into your presentation, and then you can continue with what you're talking about. So when we do these presentations, we're all very busy and we may need to practice. And I think the more we practice, the better it is. We know what we're talking about, and then you can read through your slides, pick on mistakes, and maybe realize, I don't need that. Like, we don't need to say that. So it's very good to just practice, but also use your body language. Be able to communicate with good posture, be confident, and I think that's something that we learn as we go. And we all have different styles and everything. The most important thing is transmitting the message, and for all of us, it's going to be very, very different. We don't want that. So PowerPoint is fantastic, but we don't want everybody done. Like, it's horrible to see this. You may be doing it right now and I cannot tell, which is very good. But what if we go to the other extreme and have like these very dynamic PowerPoints that are very difficult to follow? They just keep moving. That's great. And I can tell you for a webinar, it's difficult to see people's reactions as we're talking about. It's easier to be interrupted. You want to, like, somebody wants to ask a question, or it's less personal and less interactive. And I don't even know if people are here right now. In person, you have more interactive, interactions with people. You can change the pace or the tone in case I see people getting bored or the reactions are not the best I could expect. It's easier to know how many people are there or guide the audience through the presentation. And also the way that I can move or stand is going to be more helpful. So we have to be careful not going to this craziness either. And then realize that virtual right now is what we're doing, but the future is what we're seeing there. This is truly what's happening now, and this is something that we do with in congenital heart disease. We're collaborating and having a real virtual world discussion with, this is one of my colleagues in Columbus, Ohio. So we're talking about a case and we're virtually there interacting with things. Being able to present this and all be in the same immersion world is going to be the future. So we cannot be able to communicate in the current virtual world. That's going to be even harder when we don't see each other at all. So having these skills is important, but the most important thing is having the ability to explain very complex topics in an easy way. Then you know that you have reached that level of expertise that allows everyone to understand even the most complicated topics. Because really, we don't need to show off how much we know, rather make sure that other people gets to the level of understanding, mostly in these very complex topics. So in that level of discussion, I would say that I see presentations go by the stage of our career, and we all go through these stages. The first one is when we are in training, right? We need to build that knowledge that we will share. It's a lot of work. We need to make sure that we're making sense. Mostly we're presenting in front of mentors and people with a lot of experience. Then the next stage is early career. We are expected to have the knowledge, or I think we think we should have that knowledge, and we don't have the experience. So we, again, go by facts, we have to research. Stage 3, we're building that expertise, and we already have the knowledge, and we have to make sure to keep it up to date. And then we can add the personal experience to the content, saying, this is what is out there, but I've had this experience. That feels very good. And the last stage is the expert level, where you go by your experience and you have mastered the topic, but then you need to keep your presentation skills, and you have to keep people engaged. You cannot just be, this is how I do it and this is how it has to be done, or not be up to speed. So having presentation skills at this level is important to make sure that the expertise is transmitted to the new generations. So I think getting all these stages together is going to allow us to get a very effective presentation. And remember, you can be brilliant, you can have brilliant ideas, but if you can't get them across, your ideas won't get you anywhere. Thank you very much.
Thank you. That was a great presentation. Some really, really good points. I think what's particularly interesting is that no matter which stage you're at in your career, it's really important to make sure you keep your presentation skills up. I was hoping to open up a question for Dr. Wood. Dr. Wood, how can we advance the field of medical presentation? What are your thoughts on that?
First, I want to just thank SCAI-TV for having this topic here tonight, because I think back on the early part of my career and no one actually formally taught me how to give presentations. I think that we all recognize that as women in cardiology, and in particular interventional cardiology, we're going to be in the minority. And sometimes we're the smaller person on the stage or the quietest voiced on the stage. So we want to be the most articulate, most informed, and most effective presenter. Some of the ways I think you can do that, in addition to attending things like this, at our national meetings, there are often sessions on honing your presentation skills. There are also a wonderful set of YouTube videos, and there's some great content online. And later on, I'll give you a few of my points, but I think those are some of the ways, in addition to attending presentations. And when you see someone that's really an effective presenter, think about the tools that they use, the way that they presented, and how you can kind of incorporate some of those in your own repertoire of presentation skills.
Thank you, Dr. Wood. Those are some really good points. What about your prediction for the next 5 to 10 years in medical presentation? What do you think it's going to evolve into, particularly with artificial intelligence?
Well, first of all, I think Dr. Zabla showed us some really phenomenal examples of taking presentation to the next level. I certainly think that we will probably end up having, three-dimensional holographic kinds of images to display cardiac physiology and structure. If I were to tell you, you will all laugh. The first presentation I gave during my fellowship was actually on an overhead projector with these clear handouts that we would write them ahead of time with a marker, or make a copy of the journal article on a printer. And it was very old school. And to think where we are today, it's really amazing. But I will say, don't let AI write your slides for you. Don't let don't let AI fool you, because someone told me the other day, I was writing a letter of recommendation, and one of my colleagues said, "Oh, you can just have ChatGPT write it." And I said, "Nope, no way," because I want that letter to really reflect my voice. And I think the same thing comes around when we're putting a presentation together. And we heard some fabulous tips from Dr. Raj and Dr. Sabla. But you want that presentation not only to teach the audience the content that you've identified on your objectives, but you want to be able to share how that topic has been, how you've digested it, how you understand it, and how you incorporate it into your practice. There's a reason you were chosen to give the presentation that you're asked to give. And so, don't dial that one in. Do it yourself. I think AI might make it easier for you to download an image from the cloud of a single ventricle defect, or of bicuspid aortic valve that you could put in your presentation, but don't let AI do the work for you.
I think I would agree with you, Dr. Wood, particularly to the point of being able to communicate with the audience and connect with the audience and get your message across. I think the more personal it is, the better it is going to be. So thank you for that. Dr. Raj, anything you want to add to that? Any comments?
Yeah, I definitely agree. I think as regards to AI writing your talk, I think people can tell when people are genuine up on the podium and when they're not. And there's just kind of this like air about you and the way you speak and your comfort level when you've written your own words and you've practiced it and they're your slides, et cetera. I think it's pretty obvious to tell when someone is, even like now, right? Like people borrow other people's slides to give talks. Like you can tell when the person didn't write their own talk and didn't have their own slides. So I agree. I think especially like, at least for me in early career, it's like such an honor when I'm asked by other people and by societies to give talks like tonight. So I appreciate that, guys. But, I think you want to put your best effort forward. And honestly, that's how you get asked again.
Thank you, Dr. Raj. And what do you think is the biggest challenge, in presentations currently? What do you feel is something you feel like this should not be happening on the podium? It happens more often than it should be.
Two things. One, I think it's really hard for people to stick to their own time. I know like some people will have like a timer at the bottom and you can like, that almost like stresses you out more. Or like some conferences, they'll just like, if you're at the end of your time, they'll skip your last slide. So I think people need to be really cognizant about how much time you have and how much time you should dedicate to each slide and each point. And then the other thing I think is I've seen, and it's hard for me to follow when there's a lot of words on the slide because I'm trying to read the slide and I'm trying to listen to the person talking. And so I think one is just a distraction for the other. And so trying to find a way to consolidate those or for those to work together, I think would be helpful.
I think I would agree with you. I've seen people do all kinds of things when people go over time, like they have timers, they have hand indications, and turn off the slides as well. What about you, Dr. Jabla? What would you feel is the greatest, one greatest thing you see all the time in the presentations, which is a hindrance to good communication?
Yeah, I think it's critical that we keep the slides concise, but also that we know what we're talking about. And, that's a very big challenge when sometimes we get assigned a topic that we're not experts on and we take it on because, we're going to do this. And being able to communicate effectively for people, for example, I'm sure that there's more than just me with an accent. We have to slow down, which obviously I still have to work on that. And bringing up, a guide on your slides of where do you have to keep your communication about. Many people has like the presenter notes, which is something that most of you know it doesn't show in many of our conferences. SCAI doesn't have presenter notes, and so many people rely on those. And I think we all have shifted that, not all use that. So that may be used to rehearse. So a lot when you're starting, that may be a good thing just to type what you want to say on that slide so you don't get distracted. So I think communication is the key is just highlighting the key points on the slide and not really saying all that is in there. Now with webinars and recordings, it's very good. We can get back to it.
Absolutely. Dr. Wood, I think this would be a good one for you to highlight on as to how has your presentation skill evolved from your early career to now? And what is the biggest lesson you learned from your first experience?
I will say that I was really lucky because when I was in high school, I took a speech class and we had to pick a topic out of a hat. And then we had to prepare a presentation and give a speech without any notes, a 5-minute speech on the topic. And that was when I was like 15 or 16, I guess 16. And so I learned then how to think on my feet, how to really understand very deeply a topic so that I didn't have to memorize the words. I would just have the flow in my head and then kind of hit on the big points. Early in my career, I was really nervous. I've heard the topic mentioned tonight, imposter syndrome. I hate to tell you, it doesn't go away. It gets a little better over time, but it doesn't go away. So early on, the thing that I struggled with was confidence. And the best way to mitigate at least imposter syndrome when you're on the podium is to practice. Even today, when I'm going to give a talk in front of like hundreds and hundreds of people or speaking in an area that I really feel like a lot of people are, very much authorities on it, I will practice and I will make sure that in my head, I have all those key points. I think it's critical because if you have an AV malfunction, if something happens where your slide order got mixed up, anything like that, you want to just be able to seamlessly keep on going. And for instance, I was giving a presentation last week to the development board here in our health or in our hospital system, and there were some very big donors in the audience, and they offered it hybrid. So a few people called in online, and some gentleman kept turning his microphone back on and was having a conversation with his wife, and they kept trying to, mute him. And this was happening while I'm giving my presentation. And, I tried to imbue some humor into it. I tried to just not lose my cool because, it wasn't a really sticky topic, but it was important for me to maintain composure. So over the course of my career, I've learned to do that. I saw in the comments in the chat that people were talking about things like confidence and reducing fillers. That's really where practicing in front of a mirror helps so much. Learning how to not say or because it's a very, very natural thing that people often do, and it's distracting to your audience. So I think learning how to minimize the fillers, learning how to pause and let the audience understand what you've just said. All of those little things are things that I've picked up over time that have significantly improved my quality of presentation from age 16 to age 61.
And Dr. Wood, what was the biggest lesson you learned from your first presentation?
I was trying to say the biggest lesson really I think I learned was to prepare. Just be prepared. Know the content and be prepared.
Perfect. So maybe this one will probably be appropriate for Dr. Raj. What opportunities do you seek in order to continue to improve presenting?
I don't know if this answers your question, but I'm gonna say something that I think will help me. I think accepting any offer to present really to anyone, I think improves your skills. Whether it's, I'm at Vanderbilt, so if it's me teaching my fellows about CTOs or, medical residents about angiograms, or in our women's health center, we do like a community event every year where we talk to women in the community and encourage them to, get their calcium score and things like that. Then I think that helps you also just build confidence because, obviously, you know more than the community, right? Sure, you might not know more than everyone who's sitting at you at SCAI, but you know more than your patients and your patient family. So I think it helps build your confidence, and you get used to getting comfortable in front of the podium and sticking to the time and writing slides and things like that. But I think just accepting any opportunity, how small or how big it is, every opportunity is going to make you better.
I would agree with you. What about you, Dr. Jabla? Any comments on that?
Yeah, I agree with Dr. Rash for sure. Like taking all the invitations to speak. Obviously, some of them are more comfortable than others. But I think getting, to know techniques of presenting, getting exposure to different conferences because they all have different approaches, we'll call it, to presenting and tools and complexities. I think it's very important also to deal with questions when you're in the podium and somebody comes and it can be not a very kind question or puts you on the spot. I think we have a better talent sometimes than our male counterparts to say, I don't know. And that should not make us feel less confident or okay with ourselves. I think it's very important to be confident in a way to accept we don't know or bring back with another question on very complex topics. And I think that's the biggest challenge. And I think that's also when it's more complicated to take that like invitation to speak because we feel maybe scared of the question that can come or the the judgment or feedback that can come from the people that are there, and we have to just be okay with that because that makes us grow. So just having bad feedback is going to be as good as having a great feedback on a presentation, and we all grow from that. So I think it's important for people that are scared to present because of that, and the confidence comes from there. We have to let go of things, just take the good of a bad experience and grow from there. So I think that's going to be very important to get over the fear of presenting.
I would agree with you. Also, I think the more you watch people present, the more you watch yourself, to both your points, the confidence is more likely to build. And also, as was mentioned in the presentation, that it's a dynamic process. The world's changing, presentation skills are changing. So even if you're a good presenter today, you have to keep up and keep improving, keep looking back at yourself. It's a constant improvement that matters. I do have a few questions, a few comments that came in from the audience, and it would be nice, based upon the poll results, to maybe provide them some guidance on the limitations that they feel. So one of the questions was, what challenges do you face when creating a presentation? And some of the audience responses are that I tend to repeat a lot. Is it good or bad thing to repeat things in the presentation? And I'll open it up to the panel, whoever wants to take this question.
I think that's part of the practicing. If you practice and practice and practice, you'll notice this repetition and things that may not need to be said so many times, and clean the slides. Sometimes we repeat because we have not a clear idea of the message in our head. So we have to organize our presentation and then again, practice. I think it's harder to master the skill of presenting. With time gets better, but at the beginning, practice is key, and we don't have time. I'm aware of that. We're always running and between life and work, and we have a very busy schedule as interventionists, but I think we have to put that time aside, and it's critical as you plan the presentation practice to get over that part.
And if it's about repeating a point during your presentation, I think if you are making a very clear point and giving it enough time the first time, you really don't have to repeat it over and over again in your presentation either. One of the other challenges that was mentioned is that I know the topic, but crafting it into a story and planning out what to say per slide is the trickiest. Any suggestions about that?
I will start with that one. I think really identifying that if you were in the audience, what would be the key things that you would want to hear? And then, thinking about the topic, if it's a type of procedure, what would make it interesting? Is there some nugget based on a procedure you may have done or the history of how a device was created? Do a little digging, and I'm sure you can find a story in almost anything. I think that, making that connection, telling that story, it's really a way to grab your audience in. So do your homework and identify the nuances that others may not know, and you'll have a story on your hands.
I think that's a great way of putting it. Yep, sorry, go ahead.
No, it's okay. I agree. I think also maybe just starting with a case or a case example or a mistake or a complication or something that kind of gives some kind of human vibe to what we're talking about, I think is helpful and also helps people relate to what you're talking about. And then just kind of what we are talking about earlier, like I would try avoiding ad lib like during your slides and your talk, which I think practicing and rehearsing will prevent that and help you kind of stay on topic and stay on time.
Absolutely. Thank you, Dr. Raj. The other comment, which is pretty close to this one, but probably a little bit different, is the most challenging is to decide what is the most important point that I should include in the slides, how to focus the conference. Any additional comments on that apart from knowing the audiences?
I think I've learned to be proactive with the conferences and people that invite me for a talk to understand the objectives. If we have the objectives of the talk, you can keep yourself in track and know where to start. Mostly with topics like today, it's easy to overlap what we're saying. So having a clear objective, what it's wanted from our specific presentation just allows that. And that's helped me. I don't know, Dr. Woods, do you have on any other secrets?
I think that's absolutely right. Just to kind of think about, what are those key elements that if people, and I do say this at the end of some of my talks, I'm like, if you don't walk away from this with anything other than these key messages, and I think that's a really good way to kind of summarize it. But people, especially at the big national meetings, they hear so many presentations and you want yours to stick out. So give them something to take home with them and as those key focus points, and they'll remember it.
Thank you, Dr. Wood. I mean, this is a good question. Difficulty distilling the knowledge down, how to make some topics exciting. Any tips about that? I want to chime in on that. What I feel is like one of the things that I've seen gets people excited, probably statistics. If you throw numbers there and try to give them how important that condition is, what the mortality is, or what the morbidity associated with it is, sometimes it catches a lot of attention from people. And also history. A lot of times, if you add history, that gets the topic exciting. Any other ideas around it?
Well, I will say
maybe
that.
Like,
oh, go ahead.
Sorry,
Please,
go ahead,
Dr. Raj, please go ahead. I've spoken enough.
I think this might be a good opportunity to use like some visuals, maybe like some cool cines or key images to kind of entice the audience into like something interesting or new.
I think that's great. That's a great suggestion. What about you, Dr. Wood?
Just going to say, one of the things is don't accept invitations to speak about things you're not passionate about. However, I would say, per Dr. Raj's wise recommendation at the beginning, as people are getting to know you, you do want to say yes, because it's a great opportunity. I'll never forget, about 5 years ago, I was asked to speak at the ACC on the topic of unstable angina guidelines or something. And, it was kind of a dry topic. If you really expanded it, it'd be great. I had 10 minutes. And so I did. I started with a case just because I knew that would get people going and thinking about a conundrum. And, and then once you kind of get excited about it, I think they get excited. The other point I'm going to weave in just on this line is the importance of connecting with your audience again. Either looking at people looking them in the eye, kind of adding some humor if you can, if it's appropriate, being warm. That goes a long way in helping people feel your energy about a topic. And I've heard people speak that I know could get up and talk about shoe leather, and everyone would be like, "Oh my God, that's so interesting," because they're great speakers. So, just think about the way that you feel, what you feel about that topic, and try to make it exciting with some energy.
Excellent. Thank you, Dr. Woods. What about you, Dr. Jabla? Do you want to add anything to that?
So I think it depends on the setup of the conference. I've had the experience that people, when they are engaged into the discussion, for example, we're talking about a specific topic, and you know somebody in the audience, which most of the time we know people, it's like, come to the mic, what would you do for this? So people are engaged because they know, oh, they may ask me. So, and getting ideas and perspective from other people built into your presentation is being helpful. But again, it's not applicable for most conferences, but if it's possible, it's a nice way of keeping people awake.
Well, thank you. And what if you have a diverse audience, multiple levels of training, multiple educational levels? How do you cover those topics?
I think going from the basic, it's key, because most times even experts forget about the basics, and that's, you know, what happens to all of us after a while. So I try to keep it as simple as possible, and just as Dr. would say, giving key points to take home, and can be in a wide range of things, from very specific things to very basic things. And it may be boring for some people, but I think it's harder when it goes over the head of some of the people that have the least knowledge. We can talk about cool things and have really no teaching point. So I think it's a balance, and you know you're gonna not make everybody happy, but if you can educate even the youngest generation, I think to me has more impact, and then you can discuss with the more experience about things, or they can come up and because they know more, they can ask you a question that can build on the specifics on the topic as well.
I think that's spot on. And frankly, no matter where you are in your practice, knowing the basics and revising the basics is never a bad idea, and everybody appreciates that. So thank you for that. Dr. Raj, anything you want to add to that?
Yeah, I think all that's great. I would just add, maybe find a teaching point for each different level of learner. Something, for your medical student, let's say, but you can still find something interesting for your fellow and even like your colleagues that they probably didn't know before. But I agree, always start with the basics.
And Dr. Wood just shared with everybody the 5 P's of presenting, which kind of summarizes the session really nicely. It's plan, prep, practice, perform, and passion. Thank you for sharing that, Dr. Wood. I do have a couple more questions if all of you have a few minutes. It's what would you like to improve in your presentation skills? And one of the things that they mentioned is about confidence, fluency, and adding interesting topics, which we have kind of covered for the most part. But I wanted to open up to all the panelists if there are any comments they would like to add about it, because that's been a recurring comment from the audiences. Maybe we'll start with Dr. Raj.
I was going to say I like to be less nervous when I'm up at the podium, but I think everybody probably deals with that at some point in their career. No, I think like as things that I said that I was kind of learned from fellowship and on is imposter syndrome. And I think that's like honestly throughout my career, it plays a part. But I think, for the most part, you're asked to give talks because you are an expert in the field or emerging expert in the field. And like you do have knowledge and know things and have the ability to teach other people things. I think you have to appreciate that. Just fine tuning those skills for your specific learner, I think is important.
Dr. Jablek?
I think the biggest challenge to be confident and not break in front of people is trying to silence our inner critic. And it's because we're just, starting to speak, and we know we're nervous, we hear the voice, then we're like, judging ourselves. And like, we have to make that voice go away. We need to be knowledgeable and acknowledge that we know what we're talking about. We're there for a reason. And it's a combination of the imposter syndrome that I think it's, we're more aware of it. And as we all commenting on this, it's not going to go away. But I think we have to be aware that other people, their perception of us sometimes is way better than our own perception. So being aware that we're our worst critics, it's important. And then having people that we trust to ask them, how do you think we did? What can I improve? And get it from there. Take it from there. I think just go for it. I think we have to trust ourselves and move from there. We won't be perfect on every presentation, and we have to acknowledge that as well.
Thank you, Dr. Jabla. And Dr. Wood, any final words of advice for us? to take home?
Yes, I have a couple. First, if you're traveling anywhere and you're giving a presentation, carry 2 copies of your talk with you, one either on your person or in your handbag, because computers break, things happen. Always have that. If you're speaking at a national meeting, and oftentimes you've all probably witnessed, you go in and you can update the version of your talk, either at ACC, ASC, SCAI, whatever, in the room, and sometimes it uploads, sometimes it doesn't. Before you go back to the podium, always look through and make sure it's the version you want, because I've heard so many people run into trouble with that. The third thing really is, for those of you who are still struggling with feeling confident, have now with our iPads and our computers, just record yourself giving the presentation. Do a dry run. You can do a Zoom and save it and then watch it. And that is such a great way for you to give yourself feedback and for you to work on presenting skills. Again, there's a ton of stuff online, YouTube, other resources. And if you really want to take it to the next level, you can actually work with a coach. I've never done that. I've heard it's very, very helpful. And a lot of the presidents of national societies in cardiology actually they ask them to do that because they speak on television a lot. So that's another way to take it up a notch. But I certainly think practicing in front and having that recorded video and kind of looking at things that and really, being very aware of some habits that you may want to change when you're presenting.
Thank you. Thank you for those words of advice, Dr. Wood. Great learning points today. I want to take a minute to thank Dr. Leah Raj. I want to thank Dr. Melissa Wood for being here, and also Dr. Jenny Jabla. Again, 5 P's to remember. I think that's the best take-home point: plan, prep, practice, perform, and passion. Thank you for sharing those, Dr. Wood, and have a great evening, everybody. Thank you.
Thank you.
Bye-bye.